Good morning, everyone, and welcome. Today, I will be presenting on the effects of state-level executive orders on COVID-19 transmission and mortality on Hispanic populations. I would like to recognize my thesis and research advisor, Dr. Press Hedrick, for her guidance and expertise, as well as my research team, Rachel Lovin and Sarah Jennings, for their diligent effort. My name is Reese Buie, and I'm a member of the class of 2022. I am a biology and Spanish major with a minor in chemistry. My past research experience includes effects of state-level executive orders on COVID-19 transmission conducted in summer of 2021 and identification and synthesis of potential anti-SARS-CoV-2 compounds from 2020. My presentation will include an overview of the background on this topic, the methods used to collect data, and an analysis of the results. Finally, a discussion of the findings and conclusions. This investigation dives into the efficacy of North Carolina policies that were in place to prevent transmission of COVID-19 between March 1st, 2020 and February 17, 2022. This project will discuss the barriers that the Hispanic population faced during the pandemic and examine the influence COVID-19 transmission and mortality has had on the community, as well as address the efficacy of executive orders on negating COVID-19. My research question was inspired after conducting research this past summer that observed the effects of executive orders on COVID-19 transmission. I was interested into delving further on this topic to investigate the impacts of executive orders on COVID-19 incidence, vaccination, and mortality among Hispanic population and compare this data with non-Hispanic populations. It is important to consider ethnic disparities when evaluating the effectiveness of state-level COVID-19 mitigation strategies in order to investigate the efficacy of these interventions. We expected, based on prior studies, to see higher case growth rates, higher death rates, and lower vaccination rates in counties with higher Hispanic populations. This presentation will discuss the barriers that the Hispanic population faced during the pandemic and examine the influences COVID-19 transmission and mortality has had on the community. The research objective for this project is to address whether the effects of state-level executive orders on COVID-19 transmission, vaccination, and mortality differed between Hispanic and non-Hispanic populations. Data associated with weekly SARS-CoV-2 case counts between March 1st, 2020 and February 17, 2022 were obtained from the North Carolina Department of Health and Human Services COVID-19 dashboard. This data was available for each county and ethnic groups. The estimated total population size for each group within each county were derived from projections published by the NC Office of State Budget and Management's state demographer and were used to calculate weekly SARS-CoV-2 incidence rates. The dates of statewide executive orders that were restricted or relaxed health restrictions were obtained from the NC state government website. The study variables of this project include weekly growth rates of SARS-CoV-2 cases as the difference in log cumulative case counts from one week to the next multiplied by 100. Growth rates were calculated in this manner. The primary outcome variable was the difference in weekly growth rates between two time points. The primary predictor variable was the classification of executive orders and policies as either restricting or relaxing. Restrictions such as mask mandates were enacted to decrease the spread of COVID-19, while relaxing measures lifted these restrictions. Additionally, the confounding variables, which are variables that influence both dependent and independent variables of the study, include vaccine availability, vaccine coverage, cumulative incidence level, and social vulnerability. A statistical analysis was conducted using the program R. Presented here is the epidemic curve of Hispanic populations represented by green bars and overall cumulative cases represented by gray bars of COVID-19 for the whole state between the start of the pandemic in March 2020 and February of this year. Here, each bar represents the log cumulative case count for a particular week. The growth rate was calculated as the percent change in log cumulative case count between 2 weeks. Based on this plot, you can see that the growth rate of COVID-19 cases slowed down over time, with a steep slope in January 2021, followed by a steep slope between August and October 2021, and finally a dramatic increase in January 2022, and then flattening out after that. Note that this pandemic curve only captures data until mid-February of this year, which omits the most recent surge in cases associated with the newest variant. The identification of three main peaks is common in most epidemic curves, as shown here in the 1918 influenza pandemic epidemic curve. The Hispanic population is shown to have followed the pattern as well, although on a smaller scale. The results of statistical analysis are shown through various plots and graphs. The average adjusted mortality and incidence rates associated with each pandemic wave display a significant disparity between the Hispanic population and non-Hispanic populations. The average weekly mortality rate is depicted in the plot on the left. Here we see the Hispanic population is represented by the green dots. This plot shows that Hispanic population suffered greater mortality rates across all waves. Disparities that are predicted to be present according to studies by Vega, Rodriguez, and Gruskin include disproportionate poverty in the Latino population, lower rates of health insurance than other ethnic groups, and differences in lifestyle behaviors. This study also suggests that Latinos have a lower likelihood of seeking and receiving healthcare services than the total U.S. population. Lower access to and receipt of healthcare is related to lower health insurance coverage and language barriers. These health disparities are evident when viewing the average weekly incidence rates of Hispanic versus non-Hispanic populations, which show Hispanic populations suffered greater incidence rates during each pandemic wave, Alpha, Delta, and Omicron. The plot depicted here is the COVID-19 case growth rates associated with restrictions and relaxing of executive orders on the Hispanic population as seen in green and non-Hispanic populations as seen in gray, before and after the COVID-19 vaccine became available. Growth rates declined significantly following restrictive measures. Effects of executive orders were minimal during the post-vaccination period. This may be due to more people becoming vaccinated, so executive orders had less impact overall. Pandemic responses involved a layered approach, so the impact seen after the post-vaccination period shows that the impacts at the executive level lessened as strategies were implemented. These maps show the number of COVID cases in each North Carolina county per 100,000 people over time. The data was collected weekly. These maps depict week 1 through week 100 in increments of 25 weeks. The data in this map corresponds to epidemic curve seen previously. The most pronounced spike by far is in January of 2022, and this is also what we see as the highest case rate on our maps. The effects of executive orders on mortality rates were harder to interpret. Restrictions show a decline in COVID-19 mortality growth rates. However, we also see this decline after executive orders relaxed COVID-19 mitigation strategies as well. The reduction in growth rates are an indication of improving COVID-19 metrics in general, rather than a result of executive orders. The difficulty in interpreting ethnicity data may be due to missing vaccination status from various counties, as they did not report ethnicity. The Hispanic population experienced similar growth rates as non-Hispanic populations, as it shows a decline in mortality growth rates in the pre-vaccination period as restrictions were enacted and relaxed. Vaccination rates among the Hispanic population varied significantly by county to county. In this plot, counties in green are shown to have the highest vaccine coverage. The county with the greatest percentage of vaccination coverage was Avery County. It is important to know that Avery County only has a Hispanic population of approximately 886 people, and this is very low compared to other counties. Wake County, for example, has a Hispanic population of over 115,531 people. So while this plot does not show the full picture, it is interesting to see which counties have greater vaccine coverage. Vaccine coverage by ethnicity is depicted here in the two different North Carolina state maps. It is in each map, the darker the county is, the higher the percentage of vaccine coverage. A significant point to make is that the Hispanic population is shown to have up to 96% coverage, while the non-Hispanic population has up to 67% coverage. However, it is important to keep in mind population sizes as they may vary significantly by county. The main findings of this research is that restrictive statewide executive orders were associated with a curbing transmission in the pre-vaccination period. Hispanic populations experienced higher average mortality and incidence rates during each pandemic wave, and vaccine coverage was higher in Hispanic populations. Additionally, in the post-vaccine period of the pandemic, case and mortality rates decreased regardless of whether restrictions were implemented or removed as expected due to more people becoming protected from infection. This project answers the three main study questions that were presented at the beginning of the presentation. My objective was to address whether the effects of state-level executive orders on COVID-19 transmission, vaccination, and mortality differed between Hispanic and non-Hispanic populations, and the data proves this to be true. Hispanic populations experience more health disparities than non-Hispanic populations, such as disproportionate poverty, lower rates of health, a lower likelihood of seeking and receiving healthcare services than the total US population. Lower access to and receipt of healthcare is related to lower health insurance coverage and language barriers. These disparities are present and are evidenced by higher incidence and mortality rates across all pandemic waves. This slide shows the articles used throughout the final presentation. We have reached the end of the presentation. Thank you so much for your time.